Oh, hi everyone. Welcome to my crib. Oprah and I both have elevators. So, today I'm going to be showing you the PA program, physician assistant, our labs and everything, and basically our home for the first 15 months of the program. So this is our case where we showcase pictures and accomplishments. I think it's getting updated now. Normally we have a lot more, but that's my class right there, and right there, and right there. And I love them. And, oh wait, we gotta show professor's office, the director's office. A lot of us come in here to hang out, probably much to the dismay of all of our professors. But this is Tammy, the best secretary receptionist you will ever find in your life. Dr. Kissinger, this is our clinical coordinator, another wonderful professor, I love you. Professor Iki, she's our director, love everyone here, another clinical coordinator, professor, clinical coordinator, and that's their office. They're not in there.
So tell us why we're doing this at 5:30. What did you just finish today?
I just got back from my last clinical rotation in family medicine, shed a little tear. Saving lives, you know, but really just treating sinusitis, doing some physicals, but it was wonderful. So I just got off at 5. So that's why we're doing it late night MTV Cribs. This is our, I think there are people studying, so we gotta be quiet. This is our lecture room. Take a peek. Smile, ladies. And that's where we learn everything in 15 months. Cram it all in our brain. And this is the tunnel to all the rooms. So we had, especially built for the PA program, an OR built with authentic scrub-in sinks. So we have all of our sponges. We have an iodine. We have a basic one, and we have water and soap that's not filled. But they show us how to scrub in for surgery, and then you walk all sterile, and this is real. This is how you really do it. And then you walk all sterile, and then normally you booty bump into the room. But I'll open it for you. So welcome to the OR. This is my favorite place. So we have lights, because you have to figure out for your surgeon as a physician assistant what they need to be looking at, and you get to adjust the lights and you can pull them like we actually do in surgery. You can have, do I look like an angel? Okay, so you can pull them. And then we have our lovely patient with a gown. Yeah, I think his face comes off. I'm not sure, but we won't do that to you today. But you learn how to function. One of the hardest things in surgery. So you come in knowing all of this amazing stuff and all of these medications and how anesthesia works, but you can't put the freaking armrest on. That was me. I had like a tutorial one time where I literally spent like 15 minutes putting on the armrest, taking it off, because you don't want anyone's arm to fall asleep during surgery in like a weird position, hurt a nerve or anything. And our cabinets are fully stocked with gloves, caps, masks, hair caps, and instruments. So we have sutures to practice with, we have bovies to practice with, to like buzz you when they're like, buzz me. And you go like, buzz. I had to do this one time in surgery. I was helping cut fibroids out of a lady's uterus as the surgeon's like yelling at me, like, stay close. And I'm like, oh my God. But it was so cool. And what else? We have, you know, all of our little hemostats. This is what you use to drive the needle.
What has been the most difficult symptom you've had to handle with SimMan?
with Simman, the fact that he doesn't do anything. I don't know. We haven't programmed him to do anything, so he hasn't done anything for me. He's just mostly unresponsive. Pulseless electrical activity. Chest thump isn't working. I don't know. We have also in the OR. We don't use these in the OR, but these are what we use in the spring to learn CPR and all of that good stuff. This guy's name is Steve. There is a story. Actually, no, this guy's name is Bro Tank because he comes with a gorgeous bro tank.
Ooh, nice.
But he doesn't have arms. And then his brother's name is Steve because Steve has flesh-colored hair. And there's a long story with that with our professor. But yeah, there's our guy that we learned how to do that on. Are people watching?
Yeah, your sister said hi. There's 10 people.
Hi, Erin. How are you? I love you. Okay, so here is our patient room, and this is where we do test outs, which are practices for the OSCE, which are the scariest things of your life, and it's where they watch you do a patient encounter. So, yeah, you learn how to use the bed, set it up, drape and gown patients. Yeah, you learn how to do an exam.
Do you get to use all these things over here?
Yes, ma'am. This is for like sensation, so telling me like, can you feel this? Close your eyes. And measuring JVP, jugular venous pressure. If there's any distension, measure it. Reflexes. The other day I had an 11-year-old who watched me the whole time as I tried to do a reflex, so I didn't get it. And I was like, trying. I almost went like, huh, but I didn't. And tongue depressors. And our otoscope and ophthalmoscope, so we can, see all those. We have blood pressure cuff. That's our IV pole that we can use in surgery.
So how long do you have to go to school for this?
27 months. And typically every PA program ranges from 24 to 28 months. So you get a master's degree, but there's always that extra semester, well, depending on your program, in the summer that kind of gets everyone on the same page, on the same level, because we're coming in with different backgrounds, everyone. So yeah.
Makes sense.
Here's patient restroom.
Typical restroom.
Okay. And here are our lockers and our mailboxes. But you see me? I keep that thing checked. Any other questions?
Nick, someone named Nick wants to know if you learned to use the restroom in those 27 months.
Not well, but I did. Here's the lounge. Is it okay? Coming in, say hi. He's a first year. So this is our lounge. This is necessary. Our Keurig. More lockers. Nice TV. Printers.
Everything you could need.
Where we hang out. Fridge. Necessary.
Nice.
See, and I want it to be like MTV Cribs where you do the fast walk. Do you remember?
I do remember.
So, yeah. Testing. Eyes. Read this line. Go.
PEZOLCFTD.
Wrong. So, yeah, height, weight. We won't step on that. This is our library that was so kindly donated by one of the upperclassmen. His aunt donated it. And it's actually really helpful. A lot of books that we need. We're locked out of this one, so we have to go outside.
When do you select your specialty?
When you are hey, how are you? When you're applying for jobs. So you have to go through 8 core rotations. And you get 2 electives, so you have to see certain things, and then you get the opportunity to see things you want. Me, it was plastic surgery, and it was amazing. Saw a lot of boobs, but it was fun.
Someone said hi from Kazakhstan.
Oh, really? Do you have a PA program there? Okay, so this is our lab, and this is where we do all of our physical exam, learning it, how to interact with patients, how to make sure you always wash your hands before you touch a patient, and we work through body systems, which is helpful. And now that I've been doing it for a long time and I've done 50,000 physicals in family practice, it all seems like, it's no big deal. But
all right, well, that's the majority of the facilities.
yes.
Does anyone that's live have any other questions for Kelsey before we head off for the night?
Me and I think his name's Mr. Bones. I don't know. Anyone?
Doesn't look like we have any other questions. Well, if they want to learn more about the PA Studies program, who should they get in contact with?
They can get in contact with our secretary, Tammy. Sure.
Or Betsy.
Or Betsy.
Great. Okay. Do you have a final send-off?
I'm joking. No. Bye.
Thanks so much, guys. Follow her on Life of a Raider this week.